everyone, I am Nicole Angelus Rana Aranda, and today I'm going to be assessing axillary and the breast. So first is to assemble the equipment needed. So we have here our centimeter ruler used to measure the areola and the nipple, our clean gloves, and of course our alcohol for our aseptic technique. Now we proceed to our procedure. First is to introduce yourself, verify client's identity, explain what you are going to do, why is it necessary, and how the client can cooperate. Second is to perform appropriate hand hygiene procedure. And third is to provide client's privacy. So first is to approach your client. Good day, ma'am. I'm your student nurse for today. I'm Nurse Nicole Angelo Aranda from St. Mary's University. So today I'm going to be assessing your axillary and your breast. Is that okay with you, ma'am?
Yes, ma'am.
In this procedure, ma'am, I'm going to be letting you undress, and I'm going to palpate your breast and your axillary. Is that okay with you?
Yes, ma'am.
Okay. May I just know what is your name, please?
My name is Nico John Jordan.
Thank you. So I just did my proper hand washing a moment ago, ma'am. So all I have to do is to put alcohol for aseptic technique and to wear my gloves. Okay? So, provide for client's privacy. Since you are going to expose the breast and the axillary in this procedure, make sure to close the curtains. So, close the curtains and the doors. Now, you proceed to the second procedure, and that is to do the interview procedure. So, you have your set of questions for you to get some relevant information for your diagnosis. Ma'am, our next step is I'm going to ask you a set of questions regarding this procedure, and I hope for your full consideration and honesty. Okay? So, ma'am, do you notice any breast masses and what was done about them? None. How about, do you feel any pain or tenderness in the breast and in relation to your menstrual cycle?
Yes, ma'am.
Kailan niyo po nafe-feel tong pain na ito or yung pag-tenderness?
Kapag meron na yung period time ko po, ma'am.
So it is normal po na magkaroon po tayo ng pain or tenderness when we are having or bago tayo magkaroon ng dalaw. Okay po? So do you notice any discharge from your nipple?
Sometimes, so, pero wala naman, ma'am.
Wala po. Wala. Next is, do you have any medication history?
Okay, ma'am.
Do you undergo estrogen replacement?
Okay, ma'am.
So, in terms of your family history po, meron po ba kayong mother, sister, or other relatives na nagkaroon po ng breast cancer?
Wala pa naman, ma'am.
So, how about, sir, your alcohol consumption and nag-smoke po ba kayo?
Hindi po kami nag-smoke, ma'am, pero occasional lang po yung drinking ko, ma'am.
Alcohol is occasional po.
Yes, ma'am. Bigyan ng birthday, ma'am.
So, smoking, no. Thank you. And then, meron po ba kayong sinusunod na dietary plan or high-fat diet?
Wala naman, ma'am.
How about, sir, ma'am, your weight po? Tumataas po ba to or naging obese na po ba kayo?
Hindi naman, ma'am.
Do you use oral contraceptives?
No, ma'am.
Anong age po kayo nung una po kayong nadatnan, ma'am?
12 years old, ma'am, yung grade 6 ko.
12 years old?
Yes, ma'am.
So, nagme-menopause na po ba kayo? Or matapos na po ba kayo nagmenopause?
Hindi po po, ma'am.
Ilang taon na po kayo nung nagkaroon po kayo ng first baby?
27 ata, ma'am, o 26?
Do you perform breast self-examination techniques, sir? Ay, ma'am?
Hindi po, ma'am.
So, never nyo pa pong tinatry na ipalpate or inspect ang breast ninyo? Okay. Thank you for your cooperation and your full honesty, ma'am, in this procedure. Now, we proceed to the inspection. So, first is to assess or inspect the breast size, shape, symmetry, and the contour. So, pala ko tayo na maayos. Position your client in a sitting position and then undress your client. Okay? So, inspect the breast. So, the size, the contour, the shape is normal. Another normal finding that we can add is one breast is larger than the other breast, but take note the size variation or gap. Kasi kung medyo malayo na yung size gap, that is abnormal finding already. Okay? Next is to inspect the skin breast regarding the retraction, dimpling, swelling, redness, edema, localized discoloration or hyperpigmentation, and the localized hypervascular area. So there's no sign of redness, dimpling or edema. Normal naman siya. Now, emphasize the retraction by having the client raise their arm above the head. So, tataas lang po natin ang kamay nyo, ma'am. Okay? And then, push hands together with the elbows flexed. Push lang po natin yung kamay natin. Push. Okay. And then, press down. Press hands down the hip. Okay. Press po natin. Okay. Thank you po. And now, we are ready to inspect the areola. In inspecting the areola, take note of the color, the size, or the surface characteristics, masses, and lesion. So, the areola varies from the skin tone of the client, but it varies from pink to dark brown. So, it is light brown, normal. We check the size of the areola by using our centimeter ruler. Okay. Normal naman siya. Equal yung measurement. And then, next is to inspect the nipple for any discharge, lesion, and the size and position. Okay? So, the position is everted, but it is also a normal finding if it is flat or inverted. But in this, it is everted. Okay? Pointing upward, and then there's no sign that there is a discharge. Now, we are ready to palpate the axillary of the client to the subclavicular, supraclavicular lymph node. So, this is done by the client sitting in a sitting position, and then with her arms abducted supported by the forearm of the nurse. And use your or the fingertips, surface of your fingertips to palpate the four surfaces. First is the larger pectoral muscle. Second is the thoracic wall in the mid-axillary area. Third is the upper humerus. And lastly is the edge of the latissimus dorsi muscle. So, ipapalpate lang po natin. Starting from the axillary. So, here, I'm going to palpate using the surfaces of my fingertips. So, take note for tenderness and the muscles. So, subclavicular and supraclavicular lymph nodes. Then down to the axillary again. Okay? So far, there's no tenderness or swelling and presence of edema na napalpate ko. Now, is we palpate the breast itself by letting our client lie down in the supine position. Ma'am, pwede po ba kayong humiga for me to assess and palpate well your breast?
Ito, ma'am.
So, ask the client to lie down in a supine position, and then ask the client to put his arm under his head. So, ang magiging itsura niya is ganito po. Itong itataas niya is yung arm kung saan natin ipapalpate yung side ng breast. So, if it is a right side of the breast being palpated, the right arm must be put under the head. Okay? So, ganito po ang position ng client natin. So, I'm gonna be palpating in this part. So, nalagay. So, palpate for the breast and note for the any tenderness or masses. And then, when palpating also the breast, palpate the areola and the nipple by compressing them to know if there is a discharge. Okay? I'm gonna be using circular motion or type of palpating the breast. So, I'm gonna start here at the axillary part. Okay? Going to the breast. Make sure po na sa lahat po ng parts, napapalpate po natin. So, circular motion. So, papalpate din natin yung areola and your nipple. Okay? And to know if there is a discharge, compress the areola and the nipple. If there is discharge, milk the breast along the radius to know the lobe producing milk. So far, there's no milk secretion or any discharge. Okay? And then, if there's any discharge, make sure to note the color, the amount, and the consistency, and of course, the odor. And note any swelling or tenderness on palpation. And lastly is to teach your client the proper breast self-examination technique. So, pwede na po, dress the client. So, put on the clothes. So, assist the client to be seated. And then teach the client for the appropriate BSE. So, katulad po ng sabi ninyo kanina, sir, ma'am, I'm gonna be teaching you how to do the proper breast self-examination technique. This technique is good kapag 7 days to 10 days na po kayo natapos na mag-meds. Okay po? So, tuturuan ko po kayo. Ang gagawin po ninyo is, ang tuturuan ko po sa inyo is ang circular motion. So, first is, dito po sa ating arms. Gaganan po natin hanggang po sa ating nipple. So, ganun lang po, okay? Kung meron po kayo na-feel na any tenderness, pain, so, doon na po kayo magpa-consult, okay?
Okay po, ma'am.
So, lastly is to document the findings or the procedure. That's all. Thank you.